I carefully assessed the medial tubercle of the calcaneus, the proximal and distal portions of the central cord of the plantar fascia, and performed dynamic plantar and dorsiflexion of the foot to place tension on the central cord for tears. As a quick review, both the central and lateral cords of the plantar fascia originate from the medial tubercle of the calcaneus. In the long axis transducer orientation, the central cord appears as a hyperechoic fibrillar structure that maintains a relatively uniform thickness at its attachment onto the medial tubercle. Due to its slight medial orientation, achieving an optimal long axis view requires a slight lateral tilt of the transducer, as shown in the image on the upper left. Focusing on the insertion of the central cord onto the medial tubercle, our next case is a 43-year-old recreational runner with 5 years of intermittent plantar hindfoot pain. Her symptoms worsened significantly after completing her first marathon. A standing lateral radiograph shows the typical enthesiophyte at the insertion of the central cord. However, there is a second bony projection extending more plantarly from the medial tubercle, which is better appreciated on the ultrasound images. The long axis ultrasound image of the proximal central cord at its insertion onto the medial tubercle reveals a large, plantarly directed enthesiophyte, which is also shown on the short axis view. In addition, there is hypoechoic thickening of the proximal central cord, a hallmark of proximal plantar fasciopathy. Important in this case was the presence of sonopalpatory pain directly corresponding to the enthesiophyte, which has important implications for treatment. Given these findings, an ultrasonic percutaneous tenotomy with enhanced bone debridement capabilities was recommended. This next case involves a 48-year-old recreational runner who developed bilateral plantar hindfoot pain after running a half marathon 8 months ago. Despite structured physical therapy, orthotics, and multiple changes in shoe wear, she continued to experience symptoms that limited her running. 2 palpation-guided corticosteroid injections resulted in temporary relief on the left side, but no relief on the right. The long axis image on the left shows the typical hypoechoic thickening of the central cord of the plantar fascia as it inserts onto the medial tubercle, along with an enthesiophyte consistent with proximal plantar fasciopathy. However, on the right side, there is segmental hypoechoic thickening of the mid-substance of the central cord, while the